Okay, hi everybody. So in this video now, we're going to talk about non-small cell carcinoma. So if you remember, small cell carcinoma is called small cell carcinoma because of the size of the cells of when you look at it under a microscope. So these are obviously going to be bigger cells. So let's go ahead and get started on this. And this is going to make up about 85 to 90% of all lung cancers. So about 85 to 90% of all lung cancers. Okay, and there's three types to this, and we're going to go through all three types. So there's three types. And the first one is going to be called adenocarcinoma. Okay, and then we have squamous cell carcinoma. Remember, anything that ends in OMA means it's a tumor, right? And then we're going to have large cell carcinoma. So let's go through these types. And the first one we're going to talk about is going to be the adenocarcinoma or adenocarcinoma. Okay, so the adenocarcinoma. Now, this is going to be in the mucus cells that are inside of your lungs, on the outer part of the lungs. So it starts in mucus cells. Starts in mucus cells. Of the lungs. And it's going to affect the peripheral parts of the lung. So the peripheral parts are going to be the outer part. So to give you an idea, so if I were to draw a lung right here, all right, and so basically it's going to be affecting areas that are out in here. This is the peripheral part of the lung. And probably in here too, even though this is more towards the inside. This is the left lung, by the way. There's my heart. I'll put a little cardiac notch right there. So the peripheral parts of the lungs, okay? So now, the weird thing about this type of cancer is it became more common when they started to put filters on cigarettes. And the reason being is because once they put a filter on, people had to basically suck in harder on the cigarette to get the same amount of nicotine. Plus, they had to smoke more cigarettes. So it became more common when filters were put on cigarettes. Put on cigarettes. Okay? And again, so normally the reason they put the filter on, I'm going to erase this. Normally, or not normally, but the reason for putting the filter on there is it kept the larger particles of the cigarette from reaching the lung. So filters were put on cigarettes. Because you got to figure before this, filters were put on cigarettes to keep the large part, to keep large particles. Like tobacco. Because before you used to just roll them and then you would just take a hit right off of the cigarette, so you would get tobacco and stuff inside of your lungs. So to keep large particles from reaching the lungs. Now the filter would catch those from reaching the lungs. All right. And then this, well, I'll put filters. Filters led to people inhaling more and more frequently. So in other words, they would smoke more cigarettes frequently as to get the same amount of nicotine as if you didn't have a filter. So now you have people not only smoking more cigarettes, but also smoking more often. So obviously, being that cigarette smoke causes so many problems with the lungs, this would actually make it worse in this case. Okay, so now, not only that, but the adenocarcinoma, it's the most common type of lung cancer. Okay. Okay, it's also the most common type of lung cancer for people who don't smoke. Type of lung cancer for people who don't smoke. Okay? And then it's also more common in women. And that might have something to do with hormones, or it could also be when filtered cigarettes first came out, they were geared more towards women because men would not use a filter because that was looked to be as weak. Okay, so it's more common in women. So that's adenocarcinoma. The next one we're going to do is going to be squamous cell carcinoma. So on squamous cell carcinoma, okay, so you basically have squamous cells all over your body. These are flat cells, but in this case, the squamous cells are going to line the inside of lung airways. Okay, and this now is going to start usually from the middle of the chest. Remember, we said an adenocarcinoma, it's going to affect the periphery. This is going to start in the middle of the chest. So I'm going to put SCC for squamous cell carcinoma, and it usually starts in the central chest. In the bronchi. So if you remember what we said, and I'm starting to run out of ink here. What we said is when we looked, we have the trachea, right? And then we said the trachea is going to break off into bronchi. and then the bronchi are going to break off into secondary bronchi, and then the secondary bronchi break off into tertiary bronchi. So this would be the whole parts that you would see in here, is the primary bronchi, the secondary bronchi, and the tertiary bronchi. Because remember, after the tertiary bronchi, we get the small bronchi, and then after that, we're gonna actually go into bronchioli. So this is gonna be a little further up. And to give you an idea now, you would have a lung. All right, here's a lung. And just imagine what I drew here is also on this side, and here's a lung. So you can see this is going to be more in the central areas in here because it's going to affect the bronchi and things like that. Once it starts getting out into here, we have more bronchioles and things such as that. And that's where we saw the adenocarcinoma. So this is going to start in the central chest in this area in here because it's going to affect bronchi. Okay, it then spreads to the lymph nodes in the lungs. I'm going to switch here, but this next pen is going to be pretty light because it's brand new and hasn't had a chance to be smushed a little bit. But it then spreads to lymph nodes. In the lungs, right? And you're going to find, basically, I think the lymph nodes may be a way that a lot of times cancers actually leave the lungs because it's going to get into the lymph nodes and then it's going to start to go to anywhere in the body. But then again, you do have a big blood supply in the lung, so it could be, you know, if a piece of a tumor breaks off, it's not that hard for it to get into the bloodstream. Okay, but in this case, it usually doesn't spread outside the lungs. Okay, it can grow to a large size and form a cavity in the lung. And it makes up, if I can squeeze this in here, it makes up about 25% of all lung cancers. Okay, so that's going to be squamous cell carcinoma. It lines the inside of the lung and air. Squamous cells line the inside of the lung and airways. Squamous cell carcinoma usually starts in the central chest in the bronchi, which we explained what the bronchi were, right? Then it spreads to the lymph nodes in the lungs, but it usually doesn't go outside the chest. It's usually not going to go outside the chest. And then, but it can create like a cavity inside the lung as the tumor grows. And it makes up about 25% of all lung cancers. And the last one, now we talked about small cell carcinoma, like I said. Now I'm going to talk about large cell carcinoma. Okay, and these are known as undifferentiated carcinomas. Okay, and what we mean by undifferentiated is they don't really fit into other categories. Let me go like this. They don't really fit into other categories of lung cancers. They're the least common. large cell carcinomas can spread to lymph nodes and other organs. Okay, so that's going to be the large cell carcinomas. Now, let's talk about symptoms from lung cancer. Okay, and a lot of these should be pretty obvious, but symptoms of lung cancer. And this will go whether it's small cell or the small cell or the non-small cell. Okay, the most obvious one that I think most people get right off the bat is going to have shortness of breath, a hoarse voice, okay, this is going to be due to air taking up part of the inside of the lung, so you can't move air as well in and out of the lung. You're going to get coughing and possibly spitting of blood. Chest pain, shoulder pain. The shoulder pain could be if it's coming from, if you get the cancer at the top of the lung, which is going to be up by your collarbone, or it could also be a referred pain. Okay, you can get a back pain with it. If it's more in the back, if the tumor is more towards the back of the lung, you could get back pain. It's going to be mid back pain, not low back pain most likely. You may get reoccurring lung problems. Okay, pneumonias, colds. Well, cold is a nasal problem, but usually pneumonias and things like that. One common one in all cancers is unexplained weight loss. This is because as the tumor grows, it requires energy. And as it grows in size, it requires more and more and more energy. Fatigue is another common one. A bad one is going to be bone fractures. If any cancer spreads to bone, the reason you get the bone fracture is the cancer is now going to grow on towards the bone and actually start to push the bones out and eventually breaks them. If cancer spreads to bone, that's when it becomes extremely painful. You can get muscle wasting. Muscle wasting is going to once again be due to the fact that you're using all your calories to basically support the tumor. And part of what that will do is you'll break down proteins in the muscle for energy, okay? And then because you're getting tumors in the lungs, you can't move blood around as much, so blood from the face or the neck can't get into the lung because there's a tumor there. It's almost like a clogged drain, so that backs up and you can get neck or facial swelling. All right, so these are your symptoms of lung cancer, and all of this was non-small cell lung carcinoma. So again, we had three types. We had the adenocarcinoma, we had the large cell carcinoma, and the squamous cell carcinoma. So thanks for watching.